Depression, a mental health disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest or pleasure in activities. It can affect how a person thinks, feels, and handles daily activities, often leading to various emotional and physical problems. Anxiety disorders, a group of mental health conditions characterized by excessive worry, fear, or nervousness. Anxiety disorders can interfere with daily activities and may manifest as generalized anxiety disorder, panic disorder, social anxiety disorder, phobias, or other specific anxiety-related conditions. Bipolar disorder, a mood disorder marked by extreme shifts in mood, energy, and activity levels, including episodes of depression and episodes of mania or hypomania. These mood swings can affect sleep, energy levels, judgment, behavior, and the ability to think clearly. Schizophrenia, a chronic and severe mental disorder characterized by disruptions in thinking, perception, emotions, and behavior. Symptoms may include hallucinations, delusions, disorganized thinking, and impaired social functioning. Treatment often involves a combination of medication, therapy, and support services. Obsessive-Compulsive Disorder, a mental health disorder characterized by persistent, unwanted thoughts, obsessions, and repetitive behaviors or rituals, compulsions. These compulsions are often performed to alleviate anxiety or distress caused by obsessive thoughts, but they can significantly interfere with daily functioning. Post-traumatic stress disorder, a mental health condition triggered by experiencing or witnessing a traumatic event. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. PTSD can significantly impact daily life and relationships. Attention deficit/hyperactivity disorder, a neurodevelopmental disorder characterized by difficulties with attention, hyperactivity, and impulsivity. ADHD symptoms typically begin in childhood and can persist into adulthood, affecting academic, occupational, and social functioning. Autism spectrum disorder, a complex neurodevelopmental condition characterized by challenges with social skills, repetitive behaviors, and communication difficulties. ASD encompasses a wide range of symptoms and levels of impairment, often affecting individuals differently. Borderline personality disorder, a mental health disorder characterized by intense and unstable emotions, self-image, and behavior. Individuals with BPD may experience severe mood swings, impulsivity, unstable relationships, and a distorted sense of self. Antisocial personality disorder, a personality disorder characterized by a pattern of disregard for and violation of the rights of others. Individuals with ASPD may demonstrate a lack of empathy, deceitfulness, impulsivity, aggression, and a disregard for social norms and rules. Narcissistic personality disorder, a personality disorder characterized by a grandiose sense of self-importance, a need for admiration, and a lack of empathy for others. Individuals with NPD often have fragile self-esteem and may exploit others to fulfill their own needs. Dissociative identity disorder, a rare and complex dissociative disorder characterized by the presence of two or more distinct personality states or identities within an individual. These alternate identities may have their own names, characteristics, memories, and behaviors, often leading to gaps in memory and identity confusion. Eating disorders, a group of mental health conditions characterized by abnormal eating habits that negatively impact a person's physical and mental health. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Substance use disorders, a pattern of harmful use of substances, including drugs or alcohol, leading to significant impairment or distress. Substance use disorders may involve dependence, withdrawal symptoms, tolerance, and difficulties in controlling substance used despite negative consequences. Attention deficit disorder, a former term for attention deficit/hyperactivity disorder, ADHD, primarily characterized by difficulties with attention, without the hyperactivity or impulsivity symptoms associated with ADHD. Conduct disorder, a childhood or adolescent behavioral disorder characterized by repetitive and persistent patterns of behavior that violate the rights of others or societal norms. Symptoms may include aggression, deceitfulness, destruction of property, and violation of rules. Oppositional Defiant Disorder, a childhood behavioral disorder characterized by a pattern of defiant, disobedient, and hostile behavior toward authority figures. Children with ODD often argue with adults, refuse to comply with rules, and display anger and resentment. Hoarding Disorder, a mental health condition characterized by persistent difficulty discarding or parting with possessions, regardless of their actual value. Hoarding can lead to cluttered living spaces, impaired functioning, and significant distress for the individual and their family. Body Dysmorphic Disorder, a mental health disorder characterized by obsessive preoccupation with perceived flaws or defects in one's appearance, which are often minor or imagined. Individuals with BDD may engage in repetitive behaviors or mental acts in response to their concerns. Insomnia Disorder, a sleep disorder characterized by difficulty falling asleep, staying asleep, or experiencing restorative sleep, despite adequate opportunity for sleep. Insomnia can lead to daytime fatigue, impaired concentration, and mood disturbances. Sleep apnea, a sleep disorder characterized by interruptions in breathing during sleep, leading to brief awakenings and disrupted sleep patterns. Sleep apnea can result in excessive daytime sleepiness, fatigue, and an increased risk of cardiovascular problems. Seasonal affective disorder, a type of depression that occurs at a specific time of year, typically during the fall and winter months when daylight hours are shorter. Symptoms may include low mood, fatigue, irritability, and changes in appetite or sleep patterns. Specific phobias, a type of anxiety disorder characterized by intense, irrational fear or anxiety about a specific object, situation, or activity. Common phobias include fear of heights, spiders, flying, or enclosed spaces. Somatization disorder, a mental health disorder characterized by multiple and recurrent physical complaints that have no apparent medical explanation. Individuals with somatization disorder may experience a range of physical symptoms across various organ systems, often leading to excessive healthcare utilization. Conversion disorder, a psychological condition where a person experiences neurological symptoms, such as weakness or paralysis, sensory disturbances, or seizures, that cannot be explained by medical evaluation. These symptoms are believed to be related to psychological factors rather than physical causes. Delusional disorder, a psychotic disorder characterized by the presence of delusions, which are fixed, false beliefs that are not consistent with the person's culture or background. Despite evidence to the contrary, individuals with delusional disorder strongly hold on to their delusions, which may involve various themes such as persecution, grandiosity, jealousy, or somatic concerns. Histrionic personality disorder, a personality disorder characterized by excessive attention-seeking, emotional overreaction, and dramatic or theatrical behavior. Individuals with histrionic personality disorder often seek to be the center of attention and may display shallow emotions and rapidly shifting moods. Paranoid personality disorder, a personality disorder characterized by pervasive distrust and suspicion of others without sufficient basis. Individuals with paranoid personality disorder often interpret others' actions as threatening or malevolent, leading to difficulties in forming and maintaining relationships. Agoraphobia, an anxiety disorder characterized by an intense fear or anxiety about being in situations or places where escape might be difficult or embarrassing, or where help may not be available in case of panic or other incapacitating symptoms. This fear often leads to avoidance of certain places or situations, which can significantly impact daily functioning. Adjustment disorders, a group of mental health conditions characterized by emotional or behavioral symptoms that develop in response to a stressful life event or change. These symptoms may include sadness, anxiety, difficulty coping, or impaired social or occupational functioning. Adjustment disorders are typically temporary and resolve once the stressor is removed or coping strategies are implemented. Remember, seeking help is a sign of strength, and together we can cultivate a culture of acceptance and support for everyone's mental well-being. For more insightful content, please like, subscribe, and share your thoughts in the comments below. Until next time.